Some patients are not eligible for traditional refractive surgery, so in this example we talk about ICL, Implantable Collamer Lens.
Or contact lens, more relatable to patients. Two openings are made on either side of the eye. This is going towards the temple, and here's one, here's the other one. Viscoelastic is injected after lidocaine. A main opening is made about 2.75 millimeters, maybe 3 enlarged a little bit. The lens is folded up in an injector and then injected inside the eye. It unfolds, as you can see here. It has an orientation mark since the lens is vaulted. I want to make sure that it goes the correct orientation. And you'll see a little hole on this side and a little hole on this little foot. After viscoelastic is used to push the lens down, it is placed, the little feet are placed behind the iris 4 times, 1, 2, and then on the other side, 3 and 4. There's that little hole that I mentioned. And then you rinse out the viscoelastic, and that's the whole procedure. After the wounds are hydrated, patient, we can proceed with the next eye.
I'm just absolutely amazed with surgeries like this one where, other than being dilated, patients regain vision very quickly, even the same day. I remember seeing patients ICL that afternoon after surgery in the morning, and they are already achieving excellent acuity, which is phenomenal for these patients. Now, this particular patient went through ICL in both eyes. It would be very common to do ICL bilateral, so what we saw was the right eye, and now we move right onto the left eye for the same procedure. Viscoelastic filling the anterior chamber preparatory to the insertion of the lens. First, you need a large incision like we learned about from the previous case, and this is the actual lens being implanted in the anterior chamber, which then needs to be placed just behind the iris itself.
And per eye, the whole procedure takes maybe 10-15 minutes, but the whole setup with prep between the eyes, making sure patient is okay, dilated, can take a couple of hours.
I'm just thrilled at what we have available now. Of course, there are the, like we mentioned, laser refractive surgeries, LASIK, PRK, SMILE. Some just aren't eligible, or some choose to have ICL, and we're seeing wonderful results for a lot of these patients.
And being able to do it here at AZCOPT is also helpful. You probably noticed these little holes on here. They are the current version of the ICL, also called EVO. They help the circulation of the aqueous, since otherwise the lens would block the normal circulation from behind the iris through the pupil to the front. Previously, you had to do iridotomies. With this lens, no iridotomies are necessary.
Yeah, I remember seeing that with ICLs a few years ago, where you see the hole in the iris from that iridotomy, but now those aren't needed. It's amazing.
And with this, another potential benefit, for me at least, is that no one misses ICLs anymore. Some of the previous ones, people asked, why did it have an iridotomy? There's nothing going on in the eye. You have to look for the ICL. That central hole, no one misses the ICL, but the patient does see little rings around lights or in between them and lights for some time. Nobody that I've spoken to has said, I don't see anything starting out.